This is Jennifer Chase. I'm a student at the University of South Alabama. This is Project 2. It is for educational use only, and this is a presentation about how you can use Access to assist your office in referral management. First, we are going to begin with a presentation of the business case. Our executive summary is basically if the receiving provider does not follow up on referrals, patients may get sicker and require more expensive care. The patient may instead choose to receive follow-up care at another health system. This would be a tool used by office staff to track and send referrals electronically so they can manage them. Hopefully, we would encourage more patients to choose other offices within our health organization. This would increase patient safety and enhance revenue. There is a great need for a referral system. Referrals are an important part of medical care. Some insurance companies require a referral to a specialty from a primary care provider. These referrals are difficult to track. It is important that this is done for patient safety and because it brings in additional business. A simple software solution could be developed to electronically assist in referral management. And like I said, this would bring in additional revenue and hopefully pay for itself. The purpose of this project would be to develop an easy-to-use and efficient method of tracking patient referrals. The goal would be to increase patient compliance with being seen by a specialist. The types of information sent and received would include patient identifiers such as name, date of birth, and contact information. It would also contain the outgoing incoming provider's name, medical conditions, and reason for referral. Once an appointment has been made, the provider's office can request records from that office that sent the referral for a improved continuity of patient care. If they know beforehand, they're able to get those ahead of time. There are risks and issues associated with every project. There is the cost of setting up a database of office referrals. If the hospital later purchased charting software that contains referral capabilities, the program could be made obsolete, but that is not being planned at this time. It would still be possible to circumvent the system if the sending office does not document that they are sending a referral. The receiving office could also ignore that they received a referral. We would try to monitor this and do audits and see how many referrals are worked on. And it's also very important to ensure that we are maintaining HIPAA integrity at all times when using this product. Reports. Reports can be used to keep track of referrals in one area. This can be difficult in a busy office. A program that contains a database of referrals could be used to answer the following questions. Which patients have made referrals with a particular office? What kind of referrals are being generated? And which referrals need followed up on? This gives office staff the ability to organize their referrals. It is important for different specialties to collaborate with one another in complex patient cases. These reports would be especially useful in a scenario in which a patient has to see many different doctors and receive several referrals, like in the case of a mole that later turns out to be cancerous and needs to be excised. A referral system can be made into a conceptual data model and illustrated in an entity relationship diagram. The needed entities include patient, doctor, clinic, and referral. A patient has one or many doctors, referrals, and clinics. A doctor generally has one clinic, many patients, and can write many referrals. A clinic can have one or many doctors, many patients, and receives many referrals. They also send referrals. This is important because a referral can be made to a clinic in general. Each referral can apply to one patient, several doctors and clinics, and one or more referral reasons. And that will be shown separately in my access report. When doing this project, we need to make a few assumptions. We're assuming that all the referrals will go to offices in the same health system because we couldn't really keep track of both incoming and outgoing if they went to a facility that is not using our access database. In this scenario, the hospital has large office buildings. Most doctors in town are in them, and people's insurance can go to the different doctors in the facility, so they would need to be seen there anyway. Some providers will see patients only in their office, and others will go to the hospital as well and perform care, and it is thought that this could increase revenue overall for the hospital and health system. For examples of the databases that I created and queries and reports, please see my Access document and my typed explanation separately. It was impossible for me to put that in this presentation. Access is not made for Mac. I originally made a video in which I invented some reports. However, I think it would make more sense to just do it separately. That way I'm still using the Access system and showing that I can use Access. So please take a look at that. That's going to be separately and listed as a document in the forum. This is a list of our entities and attributes are forming main entities are patient, doctor, clinic, and referral. This is all illustrated with all corresponding relationships and primary keys in my database that is available to view in the forum. Meaningful reports from data. One could find all patients who are referred for selected reasons or for a particular provider, and we will show examples of that in my section of my access reports. It is important that these reports have consistent information. A patient name needs to match up with the correct contact info and reason for referral, etc. That way, when reports are generated, they contain meaningful data that can be used for things such as audits, finding patients for a study, and to make sure all referrals are being resolved. And here are my lovely references in regards to referrals. Thank you very much for your time.